In this video, we're talking about vitamin D, the sunshine hormone your body depends on for energy, mood, immunity, and overall balance. Every morning, there's a free, powerful medicine waiting for you: early sunlight. Most people ignore it, but your body depends on it, especially for making vitamin D, the hormone that protects your bones, mood, immunity, and energy. Your body depends on it for energy, mood, immunity, and overall balance. Early morning sunlight isn't gentler because of vitamin D. It's gentler because UV intensity is lower, making it a safer window for people who want sun exposure without the higher midday burn risk. But the most efficient vitamin D production actually occurs when UVB is strongest, late morning to early afternoon. With the sun positioned lower on the horizon, UV rays travel through more of the atmosphere, reducing their strength and making early morning a safer window for people who want sun exposure without the higher burn risk that comes later. However, when it comes to vitamin D production, the body depends specifically on UVB rays, and UVB doesn't peak in the early morning. The most efficient vitamin D synthesis actually occurs when UVB is strongest, typically late morning to early afternoon, when the sun is higher in the sky and UVB can reach the skin more directly. This is why short, controlled exposure during these peak hours produces the most vitamin D in the least amount of time, even though the burn risk is higher. Early morning, before 10 a.m., UV intensity is at its lowest, making this the safest window for casual sun exposure. Burn risk is minimal, which is especially relevant for people with fair or sensitive skin. However, the trade-off is that UVB levels are generally too low to trigger meaningful vitamin D production in the skin. This gentle light is ideal for supporting circadian rhythm and overall wellness, but effective vitamin D synthesis usually requires slightly stronger UVB exposure later in the morning or early afternoon. The trade-off: UVB levels are generally too low to trigger meaningful vitamin D production in the skin. Peak hours, 10 a.m. to 2 p.m., UVB reaches its maximum intensity because the sun is nearly overhead and rays pass through less atmosphere. This is when your body can produce the most vitamin D3 per minute of exposure. But the burn risk is significantly higher, so unprotected time needs to be limited to roughly 10 to 30 minutes, depending on skin tone and latitude. Think of midday sunlight as concentrated energy. It can build you up or break you down depending on how you use it. A brief, intentional dose can support your hormones, your immune system, and your mood. But staying too long turns that same energy into stress for your skin. The goal isn't to avoid the sun, it's to understand it. Use the strong hours wisely, and your body will thank you. When your skin is exposed to sunlight, it produces vitamin D, also known as calciferol, its scientific and medical name. It's one of the few vitamins your body can actually make on its own, but only when it gets the right kind of light, specifically UVB rays. Sunlight triggers a natural chemical reaction in the skin that starts the entire vitamin D pathway, making light exposure an essential part of how your body maintains strong bones, supports immune function, and regulates overall health. Timing matters a lot. The best time to get sunlight is early morning, roughly 6:30 a.m. to 9 a.m. When the sun is gentle, UVB is present but not harsh, and your skin can safely begin vitamin D production. During this window, UV intensity is lower, UVB is present but not harsh, and your skin can safely begin the early stages of vitamin D production without the higher burn risk that comes later in the day. Early morning light also supports your circadian rhythm, boosts mood, and helps your body ease into the day, making it one of the simplest, most natural ways to support your overall health. Early sunlight also helps set your circadian rhythm, boost serotonin, improve sleep quality later at night, regulate hormones tied to energy and metabolism. It's one of the simplest, most natural ways to support your health, and it's completely free. Amazing benefits of early morning sunlight and vitamin D. Just a few minutes of early morning sunlight can do more for your body than you realize. Those gentle rays help wake up your internal systems, support natural vitamin D production, and send powerful signals to your brain that influence mood, energy, and overall balance. Early sunlight helps regulate your circadian rhythm, boosts serotonin, supports immune health, and sets the tone for a calmer, more focused day. It's one of the simplest, most natural habits you can build, and the benefits ripple through your entire body. Vitamin D deficiency is more common than many people think, and the effects can quietly impact your entire body. Over time, severe deficiency can increase the risk of serious health problems. Sometimes the body isn't just tired, it's lacking what it needs to function properly. Signs of deficiency includes weak bones and joint pain, frequent illness due to lower immunity, tiredness and low energy, depression or low mood, hair loss, and slow wound healing. Long-term vitamin D deficiency may increase the risk of conditions like osteoporosis, heart disease, diabetes, and certain cancers. That's why maintaining healthy vitamin D levels is important for overall health, bone strength, immune support, and long-term wellness. Long-term vitamin D deficiency can have serious health consequences. Over time, low levels may increase the risk of osteoporosis, heart disease, type 2 diabetes, and even certain cancers, because vitamin D plays a role in bone metabolism, immune regulation, inflammation control, and cellular health. When the body doesn't receive enough vitamin D, these systems become less efficient, which can contribute to chronic disease over the years. Your body was designed to make vitamin D naturally. When sunlight touches your skin, your body begins producing vitamin D. Then your liver and kidneys help activate it so your body can use it properly. This important vitamin plays a powerful role in keeping your body strong and balanced. Vitamin D helps support healthy bones, strengthens your immune system, boosts energy levels, and contributes to your overall health and well-being. When your levels are adequate, your body can absorb essential minerals, fight off infections more effectively, and maintain steady physical and mental vitality. It's a small nutrient with a big impact on long-term wellness. How the body naturally produces and uses vitamin D. The process begins when sunlight reaches your skin, allowing UVB rays to make contact. In response, your skin produces vitamin D by converting sunlight into its initial form. From there, the liver and kidneys activate it, transforming vitamin D into the biologically active form your body can use. Once activated, your body uses vitamin D to support bone strength, immune function, muscle health, and overall balance and wellness, making it essential for daily physiological function. How much sunlight do you really need? Early morning exposure allows gentle UVB rays to reach your face, arms, legs, or back, supporting natural vitamin D synthesis. For optimal results, spend 10 to 30 minutes of midday sun several times per week, exposing arms and legs without sunscreen. Remember, skin tone matters. Darker skin requires more time in the sun, and season or latitude can limit UVB availability during winter. Ultimately, balance is key. Enjoy your sunlight safely, avoid burning, and protect your skin after your healthy dose. Other natural sources of vitamin D. When sunlight isn't enough, your diet can play a major role in maintaining healthy vitamin D levels, with fatty fish like salmon, mackerel, sardines, and tuna providing the highest amounts, about 400 to 1,000 IU, pasture-raised egg yolks offering smaller but meaningful boosts, around 40 IU each, UV-exposed mushrooms supplying up to 400 IU, and fortified foods such as milk, orange juice, and cereals, adding another 100 to 150 IU, all of which help support bone strength, immune function, and overall health, especially during winter or in low-sun environments. Key points from the supplement guide. Recommended daily intake is 600 to 2,000 IU daily. The amount depends on age, health status, and individual needs. Many people, depending on lifestyle, skin tone, sun exposure, and health conditions, may require higher intakes within the safe range of 600 to 2,000 IU to maintain adequate levels. But this should be guided by a healthcare professional, especially if deficiency is suspected. Best form is the vitamin D3, cholecalciferol. It notes that D3 is generally more effective than vitamin D2 at raising vitamin D levels. Vitamin D3, cholecalciferol, is considered the most effective form of supplemental vitamin D. It's the same type your skin naturally produces when exposed to UVB sunlight, which makes it more biologically compatible with the body. Research consistently shows that vitamin D3 raises and maintains blood levels of 25-hydroxyvitamin D more efficiently than vitamin D2, ergocalciferol. While vitamin D2 is still used in some prescription formulations, D3 is generally the recommended form for daily supplementation because it more closely mimics the body's natural physiology. Absorption tip is to take it with a fatty meal. Vitamin D is fat-soluble, so absorption improves when taken with foods containing healthy fats. Because vitamin D is fat-soluble, your body absorbs it significantly better when it's taken with a meal that contains healthy fats. Pairing your supplement with foods like avocado, eggs, nuts, olive oil, salmon, or yogurt can increase absorption and help raise blood levels more effectively. Taking vitamin D on an empty stomach or with a low-fat meal may reduce how much your body can use. Did you know? Vitamin D isn't just a vitamin. It functions more like a hormone, interacting with receptors in nearly every cell of the body and helping regulate hundreds of essential processes. It plays a key role in immune system regulation, bone strength and calcium absorption, mood and brain function, muscle strength and recovery, inflammation control, and overall hormonal balance. Because of its wide-reaching influence, maintaining healthy vitamin D levels is vital for supporting whole-body health and long-term wellness. Make it a daily habit by creating simple, consistent routines that naturally support your health. The kind of small, steady actions that nourish your body, strengthen your energy, and build long-term wellness without feeling overwhelming. Build a simple routine that supports your natural health, such as wake up early and start your day with intention and calm, giving yourself a quiet moment before the world gets loud. Those early minutes set the emotional tone for everything that follows, helping you feel centered, steady, and in control. When you choose to begin your morning with purpose rather than rushing, you create space for clarity, healthier decisions, and a sense of balance that carries through the rest of your day. Step outside and give your body access to natural light. Even a few minutes can help reset your internal clock, lift your mood, and signal your body that the day has begun. Natural light is one of the simplest ways to support your energy, focus, and overall well-being, and stepping outdoors creates a gentle transition from rest to activity that your body responds to naturally. Enjoy the morning sun and let its gentle light ease you into the day. Those early rays help regulate your mood, boost your energy, and align your circadian rhythm, giving your body the natural signals it needs to wake up, focus, and feel balanced. A few quiet minutes in the morning sunlight can set the tone for a calmer, more grounded day. Boost your health naturally by making consistent morning light part of your routine. Gentle sunlight signals your body to wake up, supports natural vitamin D production, strengthens your circadian rhythm, and sets the foundation for better sleep, steadier energy, and overall well-being. A few minutes each morning can create meaningful shifts in how your body feels and functions throughout the day. Nurses play a central role in helping patients understand how vitamin D affects bone health, immunity, and overall well-being, empowering them to take an active role in improving their long-term health. Nursing assessment priorities for vitamin D deficiency involve identifying early signs of deficiency, evaluating musculoskeletal strength, assessing fatigue and mood changes, reviewing dietary intake and sunlight exposure, and monitoring lab values such as serum 25-hydroxyvitamin D. First, a nurse typically focuses on assessing physical symptoms by evaluating the patient's pain level, observing gait and overall mobility, assessing muscle strength, and monitoring for any history or signs of falls or fractures. These observations help identify musculoskeletal weakness, instability, or bone discomfort that may be associated with vitamin D deficiency, allowing the nurse to recognize early risks and guide appropriate interventions. A nurse also focuses on reviewing key risk factors by assessing the patient's dietary habits, typical sun exposure patterns, and overall medical history to identify conditions that may interfere with vitamin D absorption or metabolism. This includes evaluating current medication use, especially drugs that affect bone health or fat-soluble vitamin absorption, and considering age-related risks such as reduced skin synthesis and decreased dietary intake in older adults. Understanding these combined factors helps the nurse determine the patient's likelihood of deficiency and guides appropriate screening, education, and preventive interventions. Monitoring laboratory results is an essential part of assessing for vitamin D deficiency. A nurse reviews key labs, such as the serum vitamin D level, to determine the severity of deficiency, along with calcium and phosphorus levels to evaluate how well the body is maintaining bone mineral balance. Parathyroid hormone, PTH, is also monitored, as it often rises when vitamin D is low, signaling the body's attempt to compensate for impaired calcium absorption. Together, these lab values help guide diagnosis, treatment decisions, and ongoing evaluation of the patient's response to therapy. Because vitamin D deficiency can weaken both muscles and bones, fall prevention becomes an important part of nursing care. The nurse conducts a thorough fall risk assessment, looking for instability, recent falls, or mobility challenges. Based on the patient's needs, the nurse may recommend or assist with appropriate mobility aids such as walkers or canes to enhance safety. Education is also provided to help the patient maintain a safe environment at home, including proper lighting, removing tripping hazards, and using supportive footwear. These interventions help reduce the risk of injury, while the underlying deficiency is being corrected. Medication or supplement monitoring. Nurses monitor response to prescribed vitamin D supplements and watch for improvement in symptoms. Assess response to prescribed vitamin D supplements. Track changes in symptoms such as fatigue, muscle weakness, bone pain, or mood. Monitor lab values. Follow serum 25-hydroxyvitamin D levels to evaluate effectiveness. Watch for clinical improvement. Look for better energy, improved mobility, reduced pain, and overall symptom relief. Evaluate for potential adverse effects. Monitor for signs of hypercalcemia, nausea, confusion, excessive thirst, constipation. Reinforce patient education. Encourage adherence, proper dosing, and safe sunlight exposure. Vitamin D deficiency occurs when the body does not have enough vitamin D to support essential functions, such as calcium absorption, bone strength, immune regulation, and muscle health. If you think you may have a vitamin D deficiency, pay attention to symptoms such as low energy, muscle weakness, bone pain, or frequent illnesses, as these can sometimes be associated with low levels. It's important not to self-diagnose, since many different conditions can cause similar symptoms. Consulting a healthcare professional is the safest way to get proper evaluation and testing. A clinician can determine whether vitamin D supplements, lifestyle changes, or further assessment are appropriate based on your individual health needs. Long-term vitamin D deficiency can lead to serious health issues, but one simple daily habit can make a powerful difference. Just 10 to 20 minutes of early morning sunlight on your skin, your face, arms, or legs helps your body naturally produce the vitamin D it depends on. No cost, no stress. Just step outside. In a world where we spend more time indoors than ever, it's easy to forget that one of the most effective health tools is still nature itself. Your body was designed to work with sunlight, not without it. And even a few minutes each morning can support your energy, mood, immunity, and long-term well-being.